explainer, we're tackling a topic that affects so many of us, yet it's talked about so little. We're diving into vaginal dryness. We're going to look at the actual science behind what's happening in your body, why it's happening, and most importantly, how we can restore your comfort and your confidence. Let's get right into it. Before we even get into the clinical details, I need to pause right here. It's just part of being a woman, or my personal favorite, it's all in your head. Look, in my practice, I sit across from women literally every single week who've had their pain dismissed with these exact phrases. They're told it's just something you have to expect as you get older. Well, if you've been dismissed like that, I need you to hear this loud and clear. Your pain and your symptoms are real, physical conditions. You absolutely do not have to just grin and bear it. You've been patient long enough, and your experience is entirely valid. So what's actually happening physically? Vaginal dryness happens when the vulvovaginal tissues lose their natural moisture, their elasticity, and their ability to lubricate. And the primary driver for all of this? Low estrogen. You can kind of think of estrogen as the ultimate daily moisturizer and structural support system for your pelvic floor. When those estrogen levels drop, the tissue actually becomes thinner and way more fragile. So to be clear, it's not a lack of arousal. It is a fundamental structural change in the tissue's environment. Now we really need to shatter a super common myth here. Most people just assume vaginal dryness only happens during menopause or perimenopause, right? Well, while that is a really common time for estrogen to dip, it is far from the only cause. Breastfeeding and postpartum hormonal shifts, for example, can drastically lower your estrogen. Also, certain medications like everyday antihistamines or anti-estrogen drugs, as well as chemotherapy and radiation, can trigger severe dryness. Even some hormonal contraceptives, or just periods of really high stress, can alter your body's natural lubrication. The point is, this affects women at multiple, totally different stages of life. So let's stop and ask a really crucial question, one that brings so many women into my clinic in the first place. Is it just an infection? I see patients all the time who are stuck in this incredibly frustrating cycle. They feel itching and burning, so they naturally assume, oh, it's a yeast infection or a UTI. They might even spend hundreds of dollars on over-the-counter creams or take unnecessary antibiotics, only to find the irritation comes right back. And why is that? Because the root cause wasn't an infection at all. The root cause was severe dryness causing micro-irritations that literally mimic infection symptoms perfectly. Mind-blowing, right? And that brings us to recognizing the hidden symptoms, because it is rarely just feeling dry. The physical realities can actually be quite severe. We're talking about chronic vulvar irritation, intense itching, and constant burning sensations throughout the day. In the medical world, we use the term dyspareunia, which just means pain during intercourse. But for a patient, it can feel like agonizing stinging or tearing. Because the tissue is compromised, you actually do have an increased susceptibility to real UTIs. You might notice spotting after intimacy due to tiny microtears, or simply feel a nagging discomfort just from putting on your favorite pair of jeans. It deeply, deeply impacts your daily living. I know that list of symptoms can sound incredibly heavy, but I want you to take a deep breath right now, because this explainer is ultimately about hope. Effective, evidence-based treatment options absolutely exist. We're not just going to manage your symptoms. We are going to look at proven ways to help restore your tissue health and get you back to living comfortably and joyfully. Let's start with your first line of defense at home, and this brilliantly illustrates a distinction that so many people miss. Moisturizers versus lubricants. They are not the same thing. Vaginal and vulvar moisturizers are like the daily face cream you use. They're applied every 2 to 3 days, either internally or externally, purely to improve the tissue's moisture retention and hydration over time. Lubricants, on the other hand, are used specifically in the moment during intercourse. Using a lube during intimacy is highly recommended. Think of it as your friction defense, but it is not going to fix the underlying tissue dryness. For true comfort, you usually need a tag-team approach of both. Now, if moisturizers aren't quite cutting it, your physician or gynecologist might recommend hormonal treatments. When dryness is directly linked to low estrogen, localized treatments are incredibly effective. This includes things like topical estrogen creams, small vaginal tablets, or vaginal rings. And I really want to stress the word localized here. Unlike systemic hormone replacement therapy pills, these treatments are applied directly to the affected tissues. That means they help restore tissue thickness and elasticity with very minimal absorption into the rest of your body. Okay, so here is the really crucial point. While moisturizers and hormones are great for treating the tissue itself, they don't always resolve the secondary muscle tension that the dryness triggered in the first place. Think about it. Your body naturally braces against pain, right? And that is exactly where the core solution comes in, pelvic floor physiotherapy. At OVA Women's Health, our physiotherapists specialize in exactly this. It's a highly effective, totally non-invasive, conservative treatment that targets the physical mechanics, the nerves, and all that underlying tension in your pelvic region. Now, if your tissues are currently burning or if sex is already painful, you're probably thinking, okay, is pelvic floor therapy going to hurt if I'm already so sensitive? It's a completely natural fear to have, but the answer is a resounding no. As a pelvic health physiotherapist, my absolute first priority is your comfort. We work incredibly gently. If internal work is too painful right now, guess what? We just don't do it. We can start completely externally, focusing on the nervous system and the surrounding structures. Your body sets the pace, always. So let's see how this builds into an actual treatment plan. How does physiotherapy actually fix dryness? First, we work to improve blood flow. Getting that enhanced circulation going directly stimulates your glands to produce natural lubrication and hydrate the tissues. Second, we reduce muscle tension. When you experience burning or pain from dryness, your pelvic floor muscles naturally clench up to protect you. It's a reflex, but that tension restricts blood flow and makes penetration even more painful. Through manual therapy, we help those muscles finally let go. And third, we restore comfort, helping your body literally unlearn those fear avoidance patterns so intimacy can actually be pleasurable again.
But we don't just look at the pelvic floor in isolation, because honestly, vaginal dryness rarely exists in a vacuum. We take a whole woman approach. We're going to talk about your sleep and your stress levels, because those heavily impact your nervous system's ability to relax and allow for arousal. We'll look at your posture and your general muscle tone. We even review your intimate hygiene routines. Sometimes the very soaps or wipes you're using with the best of intentions to feel clean are actually the secret culprits. They can strip away your natural moisture and just exacerbate the irritation.
Getting this kind of nuanced, specialized care really requires the right environment. Here at OVA Women's Health Physiotherapy in Burnaby, BC, we've created a safe, welcoming clinic specifically for these complex, often dismissed conditions. We have advanced training in menopause-related pelvic health, postpartum care, and pain management. The whole team here provides a warm, private environment where your pain is taken seriously from the very first moment you walk in the door. You will never be rushed, and you will never be told it's just something you have to live with. Which brings us to our final thought. You deserve to feel better. You deserve to feel comfortable in your clothes, confident in your intimacy, and truly at home in your own body. Help is available, and it's highly effective. If what we covered in this explainer sounded a little too familiar, please scan to go directly to our booking page and schedule your first, totally unhurried consultation. But I want to leave you with this final thought to chew on. For generations, women have been conditioned to accept physical discomfort as just a baseline requirement of aging. What if you simply refused to accept that anymore? Thank you so much for joining me today, and I really hope to see you in the clinic soon.